Now, labor and delivery nurses have lots of wishes, but today I want to share 3 wishes that your labor and delivery nurse hopes that you will do. I think you're going to find this information really helpful because your labor and delivery nurse really is on your side. And I think a lot of you that are here really trust labor and delivery nurses to get you the best birth possible. So glad that you're here. Let's jump into it. The first one is that you would go to your prenatal appointments. Now, labor and delivery is open 365 days a year, 366 on leap year, 24/7. We are available to you, but some people use labor and delivery like we are doing their prenatal appointments. And honestly, it's just not the same. We are not set up to do prenatal care for you. Now, if you're out of town or whatever, like we are there to help you, but it's not the same as prenatal appointments. And in fact, prenatal appointments are set at specific time frames to catch important things that could be going on for you. Now, this is especially true as you get into your 3rd trimester, but we really want patients to go to their prenatal appointments. Get those blood pressure checks, have that baby measured, do your ultrasounds. Make sure that you are making prenatal appointments a priority for your pregnancy. And I get it. You go and you're like, this was a huge waste of time. They took 10 minutes to measure my belly, asked me if I had any questions, which they briefly answered. I wish we could do better on that fact. But the reality is if you are having very boring, simple prenatal appointments, that's a win for you, right? I can promise you that there are people out there not having very simple checkups and didn't really know anything was wrong until they went to their provider. So do your prenatal checkups, try and make the appointments in advance. If it's not working for you, try and make friends with the ladies at the front desk to see when during the day is the best time for you to be making the appointments so that they fit into your schedule a little bit better. And if those front office ladies are not helping you out, talk with your provider in your room. And pro tip, make sure that you are making a list on the Notes app on your phone of questions you want to ask your provider because those appointments go very quickly. I got to say your provider does not have much time to do them, but if you have those questions that you can quickly ask them, it can be really, really helpful. We sure appreciate when you guys palpate that like button down below. It helps YouTube know that our content is quality pregnancy content, and it will help more quality pregnancy content show up in your feed, and we love it when you guys subscribe. So thanks for hanging with us. The next one is your labor and delivery nurse wishes that you would get prepared. I got to tell you, so many people come into labor and delivery with literally no preparation under their belt at all. Now, you are here on YouTube and you are probably watching my videos. I have a ton of them. And so that is a great way to start getting prepared. But I am here to tell you that the best way to get prepared is from the beginning to the end in a birth class. And I'm also here to tell you that so many birth classes are way overpriced. I actually have a birth class that I recommend that comes in well under $100. I'm going to link it down below. But the good news is it's going to prepare you and your partner because your labor and delivery nurse also wants that partner prepared. We don't want to be picking them off of the floor and we don't want them just sitting there scrolling TikToks because they're feeling anxious and they don't know what's going on. So both you and your partner should be getting prepared. It makes for better births. And when you look at the studies, it actually shows that there is less inductions necessary, less C-sections, less vacuums or forceps, and the people end up having a better birth experience overall. So getting prepared can be really helpful. And I promise your labor and delivery nurse is out here rooting that you got prepared. Now, that isn't to say that if you come in completely unprepared, that we are not there to help you. We are 100% are. I absolutely love teaching patients at the bedside. I just know it's not as effective as if it was something that they learned prior to coming to see me. And finally, your labor and delivery nurse wishes you knew that you can make the choices for yourself. Now, the hospital is weird. It runs on doctor's orders. So your doctor gives me an order that Sally wants to be induced. And when you, Sally, come in, I'm like, great, we're going to induce you. But Sally, that choice is always up to you. The choice on inducing you is not up to me. I have to take the doctor's orders. But I want you to know that you're always making the choice if you're going to be induced or not. That is a discussion you should have with your provider. I want you to know that it is always your choice about if they are going to break your water or if they are going to check your cervix. It is always your choice. Now, you can make some terribly wrong choices by just blithely taking the information of like, oh, no one needs a cervical exam that I hear a lot on social media. But learning, asking questions, those are skills that you need to be doing as you're going into your labor. And I actually have a whole video about making choices and things that you can do to practice doing that I think you guys will find really helpful if this is a hard thing for you. I'm going to link that video down below. Now, you'll see, I didn't put on here that you got an enema. I didn't put on here that you shaved your lady bits. Honestly, your labor and delivery nurse doesn't care about any of that. We want you to be comfortable. We want you to have an amazing birth experience at the hospital. But we do know that those 3 things really set you up for that great birth. Honestly, making choices in the hospital is really tricky. So I'm going to link that video I talked about up above about making choices in the hospital. Thanks for joining us here on The Pregnancy Nurse, where we get you prepared, not scared, for your upcoming hospital birth.